Hello, my name is Alexa Bautista, and in this video, I will be talking about Williams syndrome and its effect on communication. So, what is Williams syndrome? Williams syndrome is a developmental disorder caused by the deletion of certain genes before birth. The incidence of Williams syndrome is estimated to be anywhere from 1 in 7,500 to 1 in 20,000 live births. Children may be diagnosed clinically based on symptoms and then confirmed using a genetic blood test. Some characteristics of Williams syndrome are heart disease, kidney disease, difficulty feeding or a failure to thrive or gain weight, poor fine motor skills such as holding a spoon or pencil, an extremely friendly and sociable personality, high amounts of anxiety and phobias, especially pertaining to sound, and a characteristic facial profile including flat nasal bridge, long philtrum, which is the space between the nose and upper lip, wide mouth, uneven teeth, and a small chin. Williams syndrome is also associated with a mild to moderate cognitive impairment, which refers to a difficulty in areas such as learning, planning, problem solving, and visuospatial skills, including knowing how far an object is from oneself or between another object. In terms of communication, there is said to be a mismatch between the cognitive and language abilities of children with Williams syndrome, where their language skills are better than these nonverbal skills. However, there is a lot of variation in how their language compares to that of their peers of the same age, and research has shown that many children with Williams syndrome do have difficulties in various areas of language. For example, a recent study showed that children with Williams syndrome typically acquire the first 100 words around 40 months. A typically developing child of this age is estimated to have around a 1,000 word expressive vocabulary. As these children acquire more words, their relative strength in vocabulary will be in nouns, verbs, and adjectives, but they will tend to have a difficulty with conceptual terms related to where something is in space, time, and other relational words. Children with Williams syndrome have different behaviors that may contribute to the delay in vocabulary growth. One is that they develop pointing gestures later than one is typical, and the other is that they are less likely to engage in joint attention, which is when two people look at the same thing. Pointing and joint attention are behaviors that help children learn language because they create an opportunity for an adult to name what is being pointed to or looked at. Some techniques for achieving joint attention with a child with Williams syndrome are paying attention to what they are looking at and naming it, rather than trying to direct their attention elsewhere, bringing an object to where they are looking at and labeling it, or tapping an object to gain their attention and then naming it. As mentioned earlier, children with Williams syndrome are known to be sociable and affectionate. This affects the ways in which they use language with others. For example, when retelling a story, a child with Williams syndrome is more likely to use socially engaging words to get their listeners' attention, but may have trouble making inferences and identifying a character's goals in a story. Most importantly, their friendly personality may also pose a safety concern due to their openness to strangers. Introducing a story that teaches social skills and role-playing what to do in new situations may help inform a child with Williams syndrome on how to behave. Williams syndrome is lifelong and does not have a cure. However, children with Williams syndrome may benefit from a team of professionals including a physical therapist, occupational therapist, and a speech-language pathologist. Additionally, because these children typically have a strong affinity for music, a music therapist may also be able to help them reach their educational goals. If you have a child who was diagnosed with Williams syndrome, meet with your physician and discuss referrals for assessment in these areas. As your child progresses into a preschool and kindergarten classroom, these professionals will be able to provide suggestions on how to modify the classroom environment to support your child's learning and success. Thank you for watching, and if you would like to find out more, please check out these additional resources.